Question. A 60-year-old man with a history of chronic smoking presents with progressive shortness of breath and a chronic productive cough. On examination, he has an increased anterior-posterior chest diameter, decreased breath sounds, and pursed lip breathing. Pulmonary function tests reveal an FEV1/FVC ratio of 55% and an increased total lung capacity. Which of the following is the most likely underlying pathology? A. Centriacinar emphysema. B. Penicinar emphysema. C. Chronic bronchitis. D. Bronchiectasis. E. Interstitial lung disease. Correct answer is A. Centriacinar emphysema. The patient's symptoms of progressive dyspnea, chronic productive cough, barrel-shaped chest, and pursed lip breathing, along with pulmonary function tests showing an obstructive pattern, FEV1/FVC less than 70%, and increased lung volumes, are consistent with chronic obstructive pulmonary disease, COPD, specifically emphysema. Centriacinar emphysema is the most common form associated with smoking, affecting the respiratory bronchioles in the upper lobes. Option B. Penicinar emphysema. More commonly seen in alpha-1 antitrypsin deficiency and affects the entire acinus, primarily in the lower lobes. Option C. Chronic bronchitis. Characterized by productive cough for greater than or equal to 3 months in 2 consecutive years with mucus hypersecretion and bronchial wall thickening. Option D. Bronchiectasis. Presence with recurrent infections and copious sputum production with dilated airways on imaging. Option E. Interstitial lung disease. Presents with restrictive lung patterns, reduced lung volumes, and ground glass opacities on imaging.